Hello again. This is the final module of the Simpler Training module. This module 4 is entitled Writing Intervention Notes. So, as you all know and well aware, MTech pharmacists need to write their intervention on patient case notes. So it can be in writing or as a computerized entry. So most of the time we follow a standard procedure called SOAP. We use this as our guideline when we write interventions. So S stands for subjective, O as objective, A assessment, and P as plan. Some of you might have heard, some of you have already been exposed to it during your undergraduate years. Well, I was exposed to it when I was doing my master's. For those of you who have not heard of this, do not worry, because we're going to go through each and every one in detail. So subjective. It's actually patient's report of how he or she has been doing since last visit and includes current visit. So it's something that cannot be measured. It includes patient's complaints, feelings, concerns, plans, or goals. So record keywords or brief phrase if using patient codes. Objective is something that can be seen, heard, smelled, counted, or even measured. So this includes blood pressure, blood glucose, pulse, temperature, results of lab tests, physical exam. Assessment is when we synthesize and analyze data from subjective and objective portions of the notes. And plan is the types of intervention used, the treatment suggestions, date of next appointment, and include anticipated gains from the interventions. For example, have given education on management of hypoglycemia, and hopefully the number of hypoglycemia episodes will be reduced, that sort of thing. So guidelines for SOAP. It should be brief and concise, keep quotes to a minimum, use an active voice. For example, we will send a report to your doctor, not a report will be sent to your doctor. Okay. Use precise and descriptive terms. Record immediately after each session, which is what we're supposed to do. And start each new entry with date and time of session. Write legibly and neatly. For those of us who still have to write manually, I think, yes, we need to write legibly and neatly. To use proper spelling, grammar, and punctuation. In this particular research, phase 3, we will be using purple ink. The doctors will be using the black ink and nurses will be using the blue ink. Just let me know if the nurses are not using blue ink, then I will have to get blue ink pens. Sign off using signature plus your title and contact number, very important. Don't be shy, okay? Avoid terms like it seems or it appears. It seems that the patient does not know what they're talking about, you know, that sort of thing. Avoid names of family members or other named by patient. Patient claims that Mr. X said blah, blah, blah. Okay, you're not supposed to write that. Avoid opinionated statements, for example, judgments, your own judgments. Do not erase, obliterate, use correction fluid, or in any way attempt to obscure mistakes. Instead, you can just cancel just one line if you made a mistake. Do not leave blank spaces between entries. And do not try to squeeze additional commentary between lines or in margins. I'm afraid I have done that before, though. I'm guilty of doing that. But, you know, try not to do that sort of things. This is actually, the reason why I'm saying that is because this is a medical legal. So if there comes a time when the patient is suing the doctor, then this case note will be brought to court. And whoever has written in the case note will have to answer in court as a witness. So, for example, if you're the one who wrote it there, then you have to go as a witness. So that's why it's medical legal. So you have to be really careful what you write, and that's why I say when you write something, write with evidence, and use the evidence from the Simpler tool. Okay, because the evidence in the Simpler tool is from the diabetes guidelines. So, for example, write patient's daughter is in today. She said, "Leave the room, we're busy." So rather than writing patient's daughter is rude today, use sentences rather than progressive hypotension, write in full. Blood pressure dropped from 110/60 to blah, 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 right? So medical legal 2, document any recommendations you make, example, education, counseling given. limit your entries to descriptions of observations and services provided, rather than making conclusions about causes. So, in other words, do not be judgmental. The patient does not understand because the patient doesn't want to. Do not be judgmental. Keep all medical records in a safe and secure place. So it needs to be in a cabinet. And I'm sure most of you who are doing MTech, you have a separate cupboard to keep all your medical records. Medical records are confidential, so do not tell or allow anyone to touch or look at medical record unless they're taking care of that patient. So, for example, even if you go after you've done MTech diabetes and you're feeling so tired and you're out there for lunch, and then your friend comes in to have lunch with you, and you start talking about this patient. Oh, this patient, so and so. She was suffering from diabetes and she didn't want to listen to me, blah, blah, blah. You can't be talking like that, because it's really confidential. So, how do you use Simpler, and how does Simpler come into writing case notes? So this was Simpler. You have Simpler, and then you have SOAP. So you can either use Simpler and incorporate SOAP, or you can have SOAP and incorporate Simpler. So don't be confused. We'll go to the next slide. You can see this is the reference from where I took all about writing case notes. Well, let's look at the practice section. When you're writing intervention in case note, go to the case study in Module 3. Okay, pause this video and let's go to case study Module 3. So what you need to do now is to look at the templates in the next slide. Start from date, time, lab results, and use the information in case study in Module 3 to write your observation in the column. You can refer to simple handout if you've covered all the points with the patient, and therefore this will enable you to make interventions and offer your recommendations to the physicians. Okay, so for example, this is a form that I have done after discussion with my supervisors and after a lot of editing. Well, in phase 2, one of the participants, who is incidentally also taking part in phase 3 trial, thank you very much, you know who you are, she very kindly suggested that maybe, and very intelligently suggested that we should have a template to write our intervention. And I don't know why I didn't think of that before, because I was just writing my own all the time. And I used to write in the case note, patient case note, and then I used to write it in our own MTech diabetes file. So I used to do double job, and it was very frustrating sometimes. You have to do 2 things, double work actually. So when she suggested template, I thought that was a great idea. It was a fantastic idea, and my supervisors thought the same, and I don't know why I didn't think of it earlier. I think it was fantastic. So we did a template, and here's a template. So this is how the template looks like. I named it Simpler Proforma, and you start with the time, the date, the gender, age, ethnicity, all that. You fill it in. And right here, I've written here blue ink for nurse, and purple ink for pharmacist, and black ink for doctor. So you write all the names, dose, and frequency of the medications. This is for the first visit, visit number 1. Statin, cholesterol control, and all this. Write it down. Write your interventions and plan. And again, for insulin, medication, remember to write your MMS score, blood pressure, lifestyle, and education, cardiovascular risk. How many % of the risk of CVD in the next 10 years? Don't forget to write that. So for medication, I forgot to mention, you can either write the score and attach your Morisky score, or you can just list down what are the points that the patient did not score on. Like, for example, in this particular case, in Module 3, patients sometimes forget to take the medication and did not take medication when she was having a cold. So you can just write that. Okay. So 2 methods. And then don't forget to sign off here, pharmacist. And then the same form, this form will be used in phase 3, and the same form will be used by nurses and doctors. So it kind of like saved their time. And you can let your nurses know and your doctor know about using this form. But it's entirely up to them. If they don't want to use it, don't force them. But it will be good though if they use it. I don't see the reason why they wouldn't use it. Okay, there's some space for them to write as well if they think that they don't have much space to write. Okay, they have space to write. Okay, so let's go back. Okay, the next slide. So basically, this is just an example of how to write. So you can incorporate all this information here into there. So basically, it's just how you write. So for example, suggest change to simvastatin 20 milligram once cholesterol levels achieve target. According to general practice management of type 2 diabetes, advice on increased glycemia on rosuvastatin and atorvastatin. Australia. Okay, forgot to add Australia. So change to 20 milligram. Or as patients suffered from hypoglycemia 3 times a month, HbA1c above target, suggest reduce glycoside dose to 80 milligram or alternatively stop pure glitazone, exactly like that. To solve compliance, suggest combination. To do that, patient compliance assess using MMS Mirsky score. Patients sometimes to forget, does not take when not feeling well. Yeah. And then counseling given on importance of compliance, blah, blah. What is your action and what is your plan? So this was the problem, reduced dose. I mean, this is your suggestion and this is your plan. Patient given education on diet, you know, according to Malaysian guidelines. Something like this, just an example. So for follow-up, this will be the form for follow-up when patient has no doctor's appointment. So visit 2 onwards. So every time you have visit with a doctor, you use the other form. And then every time you have follow-up in the pharmacy department. Okay, so not during the clinic day. You know, follow-up in pharmacy. Then you can use this form. This is a much abbreviated form, a shorter version of the previous form. And you just write whatever you want to write. And this time there's no doctor or nurses. It's just you. Signature and name of pharmacist. Okay. You can have a look of the forms and play with it. Okay, and this will be the example of the follow-up. As you can see, it's much shorter. You can write short forms as well because this is just for your own use, you know, in the pharmacy, in your file. So you can write short forms like advice to increase 4 times a day, sort of thing. Okay. So ultimately, in phase 3, all you have to do is write something like this, use the form, and then take a snapshot of the form. The form previously used, like for example this form. So if you use this form, once you fill this form, you know, using your own handwriting, and then just take a snapshot of the forms and send it to me. Okay, you can either scan it or snap it. Okay, so, and that's it. That is the end of Module 4. Module 1 to Module 4. Thank you again so much for listening to all the presentations. Thank you once again.